So atrial fibrillation is the most common arrhythmia in world and certainly in
Atrial fibrillation.
So atrial fibrillation is the most common arrhythmia in world and certainly in United States today. It's basically irregular heartbeat coming from the upper chamber of heart. So instead of upper chamber of heart beating 60 to 100 beats per minute, it beats 350 to 400 beats per minute.
Okay, and why is that bad?
So atrial fibrillation is associated with clot formation inside the heart, which can go anywhere. If it goes to your brain, it gives you a stroke. Approximately the risk goes 5 times higher when you develop atrial fibrillation compared to the same age group you have. And if you have more risk factors, the risk goes even higher. So that's the main reason why atrial fibrillation is dangerous, because it causes stroke. These strokes associated with AFib. They are associated with prolonged morbidity and death, early death, and also it affects your heart function and you can develop heart failure down the road. So AFib treatment has 3 aspects. So the most important aspect is to reduce the risk of stroke or clot formation by taking blood thinners. That's one aspect. The second aspect is symptoms, control of symptoms. The way to control symptoms, it can be either with the medications or procedures somewhere like ablation, and in rare cases a pacemaker. And the third aspect, which is preventive aspect, is to be more active, try to control your risk factors, which includes high blood pressure, diabetes, sleep apnea, and thyroid issues.
Regular.
So electrophysiologists are specialist cardiologists who specialize in electricity of the heart. So we call it jokingly that we are electrician of the heart. So pacemakers, defibrillators, different type of rhythm issues, can be fast heart rhythm or slow heart rhythm, which includes atrial fibrillation. So electrophysiologist is a niche of one of the cardiology line, and we go extensive training in this subject after we finish our cardiology. So we are cardiologists, but we are specialized further in electricity of the heart. So as an electrophysiologist, apart from regular medications, we can prescribe advanced medications. In certain cases, we do procedures called ablations or a pacemaker. Ablation is something very particular that only electrophysiologists do, where we find the areas which are causing atrial fibrillation and we burn or freeze those areas and reduce the risk of atrial fibrillation. The success rate of those procedures traditionally was with 70%, but with recent advances, the success rate has been gone higher, 80 to 90%, and that is the risk of having AFib again. But many times what we see additional benefit, that even if it's not successful in that 10% of people, medications are easier to control the AFib. So this AFib ablation has changed dramatically in the last few years.
Risk factors.
So the most common risk factor for AFib is age. Unfortunately, as we grow, our heart changes, but that's something not we can take care of. But things which we can take care of is high blood pressure, diabetes, sleep apnea, thyroid issues, inactivity, excess alcohol. Those are the major risk factors for AFib.
What is it? Who
So
is most?
everyone is at risk, but as we grow older, our heart changes. Traditionally, age more than 65, in about 10% of American population, age more than 65 will have AFib. In less than 65, the risk is 2 to 3%.
How come?
So currently in US, 3 to 6 million of people have AFib, and we're just adding this incidence is going to be double by 2030, and about 15% of strokes happening in America and in the world are caused by AFib.
If you're having
So
it.
the most common symptom of patients with AFib feel is palpitations, means your heart going fast or irregular. It doesn't have to be fast and irregular. It can be irregular, it can be fast. Other common symptoms are lightheadedness. Some people feel extreme tiredness, and some people present directly into something called heart failure.
Skipped beats.
So not every skip beat is atrial fibrillation. Usually atrial fibrillation lasts for a few minutes, 2 hours, 2 days. So when we are talking about seconds to very few minutes, it's probably not atrial fibrillation. There are other reasons for atrial skip beats, and that can be deciphered by something called EKG or different type of monitoring, which includes Holter monitoring. Even recently, iPhone had a few apps, and it's called AliveCore, which can be used for arrhythmia diagnosis.